So in this video, I will take you through how a GMC application for Portfolio Pathway looks. So once you start the application, the first page looks like this, in which you have to choose what pathway you're choosing, in which I have put down 2023 Portfolio Pathway. And then we move on to the next page, in which you add all the qualifications that you have, including the FRCS, the MRCS, and any other qualification. But do keep in mind that if you are adding any qualification from outside the UK, you will need it uh, authenticated, which can be a painful process. So if you have an FRCS, then any other qualification will carry very little weight. Next comes the professional experience, which we have discussed earlier in the video, that it has to be continuous and a reason has to be given for any gaps more than 28 days. And the name of your job title should not be altered to match posts in the UK like SHO or F1. It should be kept exactly the same what is there in your experience certificate. Next comes the referees, and you can add as many referees as you like. They've not given a minimum number. However, I had used four in my application as I was recommended that you need at least four of them. Next comes registration and licensing. So, if you have a registration with any other country, you will need to get a certificate of good standing from the medical regulatory authority of that country. This is valid only for 3 months from the date it is issued. So, this is something you will have to do if you are also registered with any other country. Finally, we come to the main section of the application, and this is to make sure that we have covered everything in today's course. So, first section, we've already discussed the CV in the correct format, which now you know how to do it. Next is the on call rotas, which again we have discussed, along with the employment letters, which can be taken from the HR, and also you can have it confirmed by the clinical lead of the department, which can also mention your job plan. Qualifications, obviously, if you are registered with the GMC, they will have your primary medical qualification. And in addition to that, you can put in any MRCS, FRCS certificates, which will go in here in knowledge section. And then comes the logbook. So clinical experience logbook will be the 6 monthly logbook, as I said, from each hospital. If you want to showcase subspecialty in which you are working, then you can put in a detailed logbook of every 6 months, or you can just simply put the operative group for the last 6 years to show the breadth and depth of your experience. And the next section is the consolidation report, which gives you the SAC indicative number consolidation group, as well as the second group in which you separate by operative group. And these two reports will help you show that you have done more than 1800 operations, in which you were the first operating surgeon in more than 1260. Next is the biggest section of the application, the work-based assessments, and we've already discussed the minimum numbers for PBA and CBDs. And after that, this is followed by the CPD and specialist conferences. The first section, you should put on the mandatory courses, which we have discussed five of them, and then a yearly CPD to show depth and breadth of experience in varying different fields. For example, not only clinical but also academic courses, medical legal courses, management courses can be demonstrated in this section. This is followed by research. So in this, you can put in your publications, your presentations, your journal clubs, go in critical appraisal of literature. You can cross-reference a research methodology course, which you have already put in the CPD, which you can put here, and GCP again, you can cross-reference here. Then is the teaching, obviously teaching timetables. We discussed already lecture slides and feedback, and train the trainer course goes in the above mandatory courses. Next comes quality improvement. In this goes your audit presentation slides, your audit action plan or audit reports as they call it, and this is followed by the audit certificates and assessment of audit if you have taken. Next comes the management section. So, management section, we've done the leadership and management course in the mandatory courses section. Then, leadership activities, we discussed about junior doctor induction, managing the SHO rota, taking part in infection control committees, taking part in trauma steering groups, taking part in clinical governance meetings and reflections. So all the courses that you do and any management leadership activity, you need to write down your reflection, what you learned from that activity and what are you going to change going in the future. Now, as I said earlier in one of my videos, there is a lot of stress on multidisciplinary team working. So, they need an evidence of MDT communication. So, if you work in a unit where you have surgical planning meetings in which the theater coordinators, the ward coordinators, physiotherapists sit with the surgeons to plan the future lists, then you can show the participation in these meetings. Similarly, if you have MDT meetings with the radiologist or with rheumatologist where you discuss complex cases, these can be put down in the MDT communication. And often in hospitals, you have a micro meeting once weekly to discuss all the ortho patients who have infections. So they count towards MDT communication. And we discussed about having MSFs. Two of them were general MSFs, and one was a specific MSF from the immediate team that you work with. And evidence further is the appraisal, which we've already discussed, and evidence of shared decision making. This will come as the consent, which is going to come later. So, communication with colleagues, part of it is covered in the section above, that is MDT. And then you can put in the two referral letters, you can put in handover letters, or you can also show discharge summaries in this. Communication with patients are general communication regarding their management. And in the MSF, there is a section for feedback from patients. Then, as I said, they have put a lot of stress on consent. So, e-learning for healthcare can be a good source for a free course on consent. You can get some checks on consent from your supervisors. And in addition, your reference, which is like the structured report your referees will have to write when GMC asks them, it should have a mention of you being capable of consenting. Similarly, if you can put it in your appraisals and in your MSFs, that would be great. Dealing with complaints is very important. So I had already demonstrated that you need to show learning point from the complaints to show reflective practice. And again, it also goes in your reflections, that what you learned from a complaint and how will you avoid that in the future. Finally comes the working in appropriate health and safety legislation. What needs to go in here is your mandatory trust training about infection control, information governance. In addition, you can put in your and morbidity meeting minutes, presentations, as well as if you are able to get your name on the agenda of the M&M meetings. And you can also get a certificate from the clinical governance lead about your active participation in these activities. Finally, this again, equality diversity legislation, your mandatory trust training should cover EDI training as well. So this will go from the learning record that you get from the trust, and your appraisal will have section about EDI. You just giving a statement that you are aware of EDI training. And the last comes the verification of the evidence. So we discussed that you must choose one verifier from every hospital that you are submitting the evidence from, and the format is given by the GMC, and we've already discussed how you need to fill up that format. So in last, you just confirm that you have anonymized the data, and once all this is done, then you've completed your application. You need to just add your verifiers names here, and you do a final declaration, and you go on to pay. So this video covers the entire GMC application for a portfolio pathway, and this is to just show that we have covered everything in today's course. Thank you very much for listening.